They're like, really? It didn't even hurt. But hurt was subjective to them because they just wanted to play through it, unfortunately. And then regular activity and lack of, the biggest one right now I'd say for most people is lack of regular activity. Unfortunately right now, only about 5% of the U.S. Participate in an active exercise program. The exercise program most people do work towards is not that great. So like I love the commercial, I pick the weights up, I put them down. You guys like that commercial? Very funny commercial. However, the product that they sell, the $10 a month programs, they're faulted, highly faulted. $10 a month is going to get you access to a room full of equipment, 20,000 square foot, without a guidance of knowledge on what to do. And you're going to go in there, you're going to last for about 3 or 4 weeks, and get hurt, and go, wow, why did I get hurt? Well, because the product is not substantial. It's meant for someone educated to tell you what to do and how to do it, but it makes them money, and unfortunately hurts us. And that's where we're seeing a lot of things. There's a term coming around right now in the osteopathic industry called boomeritis. And boomeritis is the boomers that committed in their 50s and 60s to an exercise program in their 40s are now facing years of infirmity and hurt shoulders and can't get their shirts off because of all the years of lifting in a bad manner. So you look at a lot of lifting, it's all based on machines and they walk around like this. It's hard to get your shirt off when you're stuck like this. We're seeing a lot of joint replacement guys now too. And one of the reasons is because a lot of the exercise that we've been subjecting ourselves to is causing things to break down. So I'm trying to say you got to watch your exercise. And by the way, exercise means above and beyond maintenance, just so you guys know what exercise definitively means. Because sometimes we get with people, and I take care of one of the most prominent landscaper guys in the area, and he works by himself, and he does like every single property in Newtown Borough, and I see him all the time, and he sits in front of me all the time, and I tell him he's got to work harder, and he looks at me like, yeah, right, come out and do my job for a day. It's not about me doing his job, but his normal is just what his normal is, and he needs above and beyond that. That's the reason why some blood works don't change for people that are active. So in any case, we all need a little bit of activity. Okay, and one of the reasons why I harp on exercise so much is because it is literally that magical pill that if I said to you, you want to live to be 89 years old and have a bug of life and run around like Jack LaLanne, everybody know Jack LaLanne just passed away? Great guy, inspirational guy. He didn't look like this when he died. He was like this, okay, and he bragged. He bragged a lot. You guys probably know that too. Bragged about his wife. He's 20 years younger and he had relations. So, great guy at 90-some years old. But what he did basically was he followed a wellness-based lifestyle. He took active, lifelong progression. He started this back in the 50s, guys. If you go on YouTube, an interesting thing, you can Google Jack LaLanne and see his clips from the 50s and the 60s of when he sat in a chair and looked at our parents and grandparents and said, hey, guys, listen up. And he had the same exact message I'm giving you today. It's pretty scary. That's from 1950s and 60s. So this isn't new stuff. Again, he knew common sense. Okay? And then once you guys get common practice. All right. Emotional stress, because I think it's going to hit you guys too. School, anger, time, relationships, family, grief, financial, and ultimately jobs. Okay? They're all stresses. Okay? They all come at us in different ways. If you guys don't notice, we have about 64,000 thoughts a day. About that? Teresa's our meditation expert, by the way. She's a CA and she also does meditation. You didn't know that? 64,000 thoughts a day.
I have more thoughts.
Yeah, okay, good. Do you know how many of those are negative? How many are negative?
Well, roughly 80% of the thoughts that we have are the same thoughts that we had yesterday. So if you ever feel like your life is stuck in a rut, there's a real good reason why. And of that 80%, so that's what, 48,000 thoughts or so, roughly 90% of the thoughts we have don't serve us, which means they're based in the past or the future, based in fear, they're not self-serving, they're not productive. So if you ever wonder what's going on, how do we know what we're thinking unless we observe our thoughts? And that's one of the reasons why yoga and meditation is so beneficial.
Yep. And then the awareness, guys. Remember back in that definition, it was about the awareness and looking at priorities. And maybe make it, like for me, it was tough because being a lifter and a type A personality, meditation was very tough. But it's also as tough as going in and benching at 350 pounds, which was tough. I have to work at it. I take 2 minutes in the morning, it goes to 5 minutes, goes to 10 minutes. Next thing I know, my kids get on to me and they get up with me in the morning, which I'm like, oh, now I can't meditate. So I get up earlier. Okay, so I'm up at 4 o'clock. But I'm trying to find that time. No, I'm just joking. I get up at 5 o'clock every day. But I would get 4 o'clock if I had to. But I give myself an hour of power every morning. The hour of power consists of a little bit of meditation. I go through an Excel spreadsheet that I designed myself with little tabs on the bottom that have my life in there, which has my mom, my wife, my kids, my family, my work, all that stuff, and little problems listed in there. And I just evaluate it. And I update it about once a month, and I take care of it. You know, the tax is the big one. I just got that off my chart, so it's like no more eye twitch, which is always nice. But I finally could take care of it. But it was there February, it was there March, and finally in April, it was just getting to the point where I was affecting my sleep, and I realized what it was. And it was just getting that tax control. Finally got it done. All right, so that's off my plate. So now I can focus on other bigger things. And on that chart, there's a chart between things I can handle and things I can't, guys. You know, in a real estate business, you guys really can't control a whole lot of things. You know, it's kind of out of your system for the most part. And when you realize that, you just can't stress on it. You guys got to look at it from that point and go, you know what? That's on my list. It's number 10. I'd rather focus on number 1 for the most part. Maybe number 1's, you know, looking at a new model or looking at a new system that you guys say, you know what? I might be able to get a couple extra clients out of this, or I might be joining that one club, and you know, I've been putting it off because I'm afraid to be in front of people. Well, put that first. And the next thing you realize, you don't stress about number 10 anymore. You look 3 months later, you're like, wow, 6 sales. You know, what is here? I'm doing great. It goes off the chart. So it just comes down to making smart decisions on that job aspect. And, of course, everything else in there, too, financials and all that stuff, like I was saying. And then another one, too, is our biochemical stresses. Guys, there's way too many things. Like I just joked about McDonald's being on the corners. There's more processed food, refined sugar, prepared foods, fast foods, additives, preservatives, lack nutrients, and dehydration in our society than ever before, okay? Because we're chasing after that big money dollar, and big money dollar comes in. Crap food, crap, water, or juices, or coffees, or whatever you're going to talk about. It's based upon there. It's not based upon the good stuff. It's not based upon vegetables and fruits and lean proteins with good nutrition and lack of toxins in them. And then over here, your prescription drugs, your illegal drugs, your over-the-counter drugs, your tobacco, alcohol, and caffeine. These are all the biochemical stress that eventually add up. So you guys, I heard when I first walked in, you guys were all stressed. I realize that. And I think you're stressed in this area, and I think you're stressed in this area, and I think you're stressed in this area. And if you guys think our body's smart enough to give you a disease based upon one stress, It's not just work that's giving you the ulcer. It's not just work that's giving you indigestion. It's a combination of everything. It's those choices you're making when you're eating. It's those choices you're making when you're sitting on the couch and you realize, well, 4 hours you sat there, you haven't moved yet, you're like a zombie. There are all those choices that we have to say, well, the reason why I'm having this ulcer, this worry, is because of a combination of everything. So when you look at yourself and you look at making a change, you need to focus on all those areas, not just one. Joining the gym's a great thing. You get active, you get moving. It's one thing. Starting meditation, reading a book, going to yoga, going to church, good thing, but it's part of it. Engaging in better eating, reading the books, coming in and listening to some of our lectures on our 80s to Wellness. We have one every other Thursday night with Dr. Denise, does a whole nutritional section. Everyone should hear it. It's very basic, very enlightening, and it gets you to a really good point when you leave there because you understand nutrition a little better. So you take care of that aspect too. All right, so here's our beautiful wellness wheel, our wellness wall. So when someone comes in our office, if you guys have that sheet, and take a peek at it real quick for me. It looks just like that. It's got a little thing on there. All right, so when you take a peek at that sheet, every single patient that sits in front of us, it's our second sheet on this packet, when I pass that around, is this wellness score. So what you're going to see typically, by the way, it would say 50 up here, so 50, 100. Okay? 50 obviously in school, guys, we don't like getting that because our parents will yell at us and we get in trouble, change our habits, right? We probably go to bed a little early, do all of our homework, all those kind of things because our parents were really good guiders in that portion. And ultimately we get up to a 75, and maybe to 80s and 90s. Some of us were excellent at it, just always got 90s and 100s, but for the most part we find ourselves down here and have to work towards it. So from 50 to 100, can anybody guess for a half-hour free massage the exact number that most people come in to? Any ideas? When someone walks in and sits with me, between 50 and 100, what's
61.
55. 58.
Keep going.
30.
Probably 54.
Keep going. He was close.
62.
Closer.
63.
89. 64.
65.
Right there in the red. 64. All right. Some reason. Okay, it's 64. Okay, it's probably about our average number. Now that's for our, we'll note that down for a half hour for massage break. All right, so that's a 64. Right there. So it's between symptoms and no symptoms. Okay? So when you look on your chart, and it might be hard to read up here, you'll see it's diseases are developing, persons in poor health, they have symptoms. So obviously, with chiropractic, we get mostly what? Back pain, neck pain, shoulder pain, elbow pains, all those kind of fun pains. So pain's a big motivator. Okay? So when a patient comes in, they sit there. The great news I have for them is this. I'm not sure if you know this or not, but chiropractic has a 95% satisfaction rate. Okay, it's not like a guaranteed rate or a success rate, like where the person just walks out of the mirror. Satisfaction, meaning when a patient comes in as a chiropractic patient, in 8 to 12 visits, that patient walks out of our facility saying, "Doc, I don't know why I didn't do this sooner. Okay, I'm not on ibuprofen, I'm not on aspirin, I'm not on anything else anymore. I feel like $1 million. Okay, and I want you guys to break down the secret of chiropractic right now. It's very simple: movement. That's all it is. When you come in with a fixated back and your back hurts, well, it's because it has those segments that are stuck together. They're stuck together because it's like wearing a brace. And when you ever had a broken arm, anyone here, you took the broken arm off, it's like, oh, it hurts when you move it. Well, when I adjust you, I'm breaking that brace. I'm moving that brace around. The body says, whoa, I can move better. So the body says, hey, more movement, less pain. And as soon as you settle back into that crappy posture again, well, less movement, more pain. It's real easy, guys. Not again, common sense. Very easy stuff. So right about here, okay? So I always draw a line right here, and I say in about 8 to 12 visits, I'm going to get you to here. I wish it was one, guys. I wish I had power in my hands to numb them up, put a bunch of stuff in there. But it's not, because it's natural. There's no toxicities to it. There's nothing there. It gets them to this point. Okay, when you get to this point, it's great. You shake your hands. Good job. No more pain. But it's not over yet. We have to go higher, okay, guys? Because I don't want to let go of someone go here. This is the typical chiropractic problem. They let them go right here without influencing them to get up here. The influential portion, getting them up here versus keeping them here, is when that back pain comes back and they didn't correct their posture because they didn't listen to me about exercises, they didn't change their diet because they have this big beer belly still, about 40 pounds sitting out there, back pain's going to come back. The problem is they slide back to 60, 59 area, they got less. Anybody know the reason why they got less? What happened between 60 and 64? About a year of life. They got older. Okay? They got older. So they slip back into the 60 area. Next thing you know, they're 59 instead of being 49. 10 years went by. Okay? But it will come down. But the people that commit to it and they say, wow, you know what? That regular exercise, that good nutrition, and keeping me in touch with you, Doc, it gets me up to this point where I can keep myself at a 90 or an 80. And guys, we have people in their 80s and 90s. We have people that are in their teens in the 40s and the 50s. Okay, so it's not age dependent. It's not male or female dependent. It's pretty basic. If you had a chance to look around, I want to kind of go through this. This is our standard patient workup. So every patient comes in. They get measured on 10 different things. So this is where that score's coming from, just so you guys know. That 50 up to 100 is based upon these 10 scores. On these scores, we color code them, guys. We make it super simple for you. Green means, great job. Red means, oh boy, we got to look at that. And yellow means, hey, we're working on it. Let's see if we can't get anything better. Okay, so the first one on there, this is going to be, I got a guy question coming up. Age, doesn't matter, no score. Male or female, doesn't matter, no score. BP diastolic, anybody know what blood pressure is? Anybody know what a good blood pressure is? I just talked to Dr. Oz this weekend, by the way, no lie. I was down in Philadelphia in Temple University, listening to him talk and had to ask him a question. And he told me what good blood pressure is. Anybody have an idea what good blood pressure is? Close, 115 over 75 is good. 120 over 80 is normal. He wants 115/75 from his patients. Very smart fellow, by the way. He almost gets it, but not yet. And that's just truthful, because he's still a little indoctrinated into his medical mindset that he wants to intervene too much. Now, his wife actually wears the pants in his family. He told me that, which is cool. She's a Reiki practitioner. All that energies. Yep, she pushes him. Yep, she takes his indoctrination and goes, no, it's not right. It's all about health and wellness. And so that's kind of where you're seeing Dr. Oz is actually him and his wife. So don't think it's Dr. Oz. It's actually Dr. Oz and Mrs. Oz, which is good. All right, so the next one. This is a question for you. What is BMI?
What's flux capacitor? Why?
Because when
Pick it on me, man.
when I ask this question, does anybody know?
Body mass index.
Thank you. Perfect. All right. You got it. So when I ask my male patient, what do I get? Bowel movement irregularity. I'm like, no, it's not bowel movement irregularity. It's BMI. All right. BMI was established by the insurance companies, guys. BMI. BMI is because the insurance company employs a bunch of actuarians who are more nerdier than we are, who sit in office and crunch numbers about based on morbidity and death and all that fun stuff. And they said, wow, look at this. If we take a person that's going to be 5'6" and maybe 280 pounds, their BMI is at 35. They're going to die. 70% more likely chance of dying within the next 6 years than a person that's at a BMI of, say, 25 or 18, which is ideal, 18, 25. They know it. That's why those numbers out there. They know it when you apply online because everybody's looking for cheaper healthcare and you put a BMI in and it says, boom, automatically I weigh this and I weigh this. And the doctor said I weigh this and this. Your premiums are here. Okay, not here because they know that most likely you're going to have some sort of infirmity. Remember the 70% of lifestyle controlled stuff? They know right away you're going to cost them 70% more money based on that. Simple little number. So it's a very impactful number. Now, we skew that number where Steve here is 28, which he's between 25 and 30 is considered overweight. 30 and above is obese. 35 plus that is morbidly obese, when you can drop that any minute. Sad number. But the next one's waist to hip ratio. Waist to hip ratio is the ratio between your waist versus your hip. Okay, it's another insurance number because they want to know where you're carrying that fat. Okay, if you're walking around with a huge waist to hip ratio and all your fat's sitting in your belly, it's killing you slowly. Okay, it's not killing you because it looks ugly and you don't look good in a dress or your jeans don't fit anymore. It's killing you because that fat sitting there is storing all the toxins that we're being exposed to. And I'm not just talking food toxins, I'm talking mental toxins. When you create more cortisol in your body, it stores it in your fat. So what happens over time is that fat that's sitting there is slowly pushing back into our system all these toxins we're exposed to. So the fat, the meats, the vegetables are sprayed with toxins. All those things are being leached back into our system, causing inflammatory conditions. If anyone wants to know what you're dying from in here, it's inflammatory conditions. If it's cancer, heart disease, or diabetes, it's all based on inflammation.